Welcome back. The new COVID-19 variant, Lambda, is not yet a concern for African countries. That's according to the University of KwaZulu-Natal Professor Tulio de Oliveira. He says none of the African countries have detected this variant. He says the main concern remains the Delta variant, which is driving current daily infections. De Oliveira was among the panelists at the World Health Organization Africa's virtual conference that was taking place earlier. My colleague, eNCA reporter Heidi Giokos, has been monitoring that webinar or conference. Joining us now via Zoom. Good afternoon, Heidi. Welcome to the Midday View. How much damage is Delta said to be doing, not only to South Africa, as we currently know, but to the rest of the continent?
It's a huge concern, Dan, and this is because we know that 16 countries, which include South Africa and neighboring countries, have, of course, seen a resurgence. Many of them are going through their third wave of COVID-19, and it seems as though the Delta variant is very widespread. There's a huge concern because, as you know, the African continent has almost been last in line to receive vaccines. And this means that because most of the population on the African continent is not vaccinated, the target for the new variant means, that it can be easily transmissible on the African continent. And of course, there's a high possibility for severe infection and hospitalization. So it seems as though the World Health Organization says that there is hope at the end of the tunnel for Africa, but there's still a big concern because the Delta variant seems to be dominating in a number of countries. Let's listen to a little bit more on what the Delta variant is doing on the African continent.
But what we really worry at the moment, and just to bring you very recent data, is that it has to begin to dominate not only South Africa, but all the African infections. Again, this is when you pull all the data of Africa together, around 75% of the recent genomes of Africa is Delta, and has entered all regions of the continent. Yeah, we are talking about Southern Africa, East Africa, West Africa, Central Africa. As we increase genomic surveillance, more important is really increasing the response, given that this Delta variant is much more transmissible. It causes potential risk of reinfection with the Beta.
Just listening to that and seeing that graphic that Tulio de Oliveira was showing there, we know, of course, that many African countries are not testing high numbers of people in their population. So the real true picture of how far the Delta variant has been wreaking havoc will take some time to be seen. So all care has to be taken. But Africa is still battling, of course, with that huge concern of vaccines for the continent.
Yes, certainly. And there seems to be many people phrasing it that there's a lot of hogging of these COVID-19 vaccines. And as you can see, that higher income countries and more advanced economies were able to get vaccines a lot quicker, and they were able to vaccinate their population a lot quicker, which is to their advantage. Because if you see what's happening in the UK now, for example, Dan, there is a high number of positive COVID-19 cases, but if you look at their daily death rates and hospitalization rates, it is extremely low, which just speaks to the fact that vaccines actually do make a difference with regards to hospitalization and severe COVID-19, which is essentially what the South African government is trying to aim for, is to try and avoid the pressure on our hospital facilities. But just an interesting fact, 50% of vaccines that have been administered globally have been in higher income countries, with only 14% administered in low and lower income countries. And this is, of course, a huge concern, especially for the African continent, with COVAX now announcing that they will be donating a number of vaccines. But it's still a big concern. If you just see what's happening here in South Africa, there's been a big concern to say there needs to be more pressure and more emphasis on the vaccine rollout because of what the Delta variant is currently doing. We've been recording over 300, 400 deaths in the last 4 to 5 days, which is extremely alarming. But let's listen more on the vaccine issue for the African continent.
Vaccine shipments are gathering momentum. In the last 2 weeks, more than 1.6 million doses have been delivered to Africa through the COVAX facility. Thanks to France, another 300,000 doses of the AstraZeneca vaccines are expected today in Kenya and Somalia, and donations from Sweden and Norway to additional countries are currently being finalized. COVAX has been working tirelessly to clinch dose-sharing pledges and procurement deals with manufacturers to ensure Africans get their vaccines. We expect more than 20 million doses of Pfizer and Johnson & Johnson vaccines to arrive from the United States soon through COVAX in coordination with the African Union. Other significant donations are expected in the coming days from more partners, and Ms. Nguyen will tell us all about this. There is still a long way to go. So far, 50 million doses have been administered in Africa, accounting for just 1.6% of doses globally. 16 million, or less than 2% of Africans, are now fully vaccinated. This means that hundreds of millions of people are still vulnerable to infection.
You know, on another matter that's sort of developing a story we're watching, when I had this the other day, 2 days ago for the first time, I said, what the V? I mean, another variant? Heidi, the world is facing yet another variant. Lambda, there's an interesting name coming from Latin America, but it's not here in South Africa. That's what we were told. The World Health Organization say it's a variant of interest, but I'm worried.
Yes, certainly, Dan. And the reason why many are worried is because when Delta arrived, everybody said, relax, calm down. It's not in South Africa as yet. And then when it did arrive in South Africa, we were still told to calm down and relax. And now it is ravaging and it's driving the country's third wave. But what's interesting here, and I keep saying this, is that I just hope by the end of this pandemic we won't know the whole Greek alphabet, because every time there's a new variant, there's a new Greek alphabet that is brought about. But the Lambda variant has not been picked up in South Africa and on the African continent. And we do know that from surveillance that has been done so far, there's just the Delta variant, and it seems as though those involved, and especially the World Health Organization, saying it's no reason to panic at the moment, and there's very few studies that have been done to determine how transmissible this is, how serious it is, and how far widespread it is. As you mentioned earlier, there's not as much testing that's being done, especially on the African continent, and possibly if more testing is done, we'll be able to pick up how far wide the Delta variant is, but also if Lambda has arrived, and hopefully it has not, because we surely can't afford another variant in the country. And it speaks again, Rodan, to the fact that we need to vaccinate, because the more people are vaccinated, the less opportunity variants have to move around and cause destruction.
And the less chances of severe illness if you get infected with COVID-19. I did interview Dr. Lessings from CRISP the other day, based in Durban, around this whole issue of Lambda. And the only kind of assurance he gave was it is still yet a variant of interest. You talk about the Greek alphabet. You've got alpha, beta, well, I don't know what is the C one, and then you've got delta. Then you've got the others. He said there are about 6 or 7 or so variants of interest, which have not developed into a variant of concern. Let us hope that this variant of interest from Latin America doesn't find its way here all the way, samba all the way from Brazil and find its way to Africa. Let's hope it doesn't happen. Everybody must watch it like a hawk. Thank you very much, Heidi Giokos. They're giving us a sense of what's happening currently with that meeting of the World Health Organization Africa, focusing, of course, on these variants of concerns, variants of interest, and the lack of vaccines for the continent. In the meantime,